Welcome back to Just Balance. I'm your host, James Seetelo. In this segment, we'll dive into the law, policy, and justice in South Africa. We'll find out more about one of the most significant legal battles in our healthcare system's history. Joining us today for this conversation is Dr. William Oosthuizen, Head of Legal Affairs at the South African Medical Association, a seasoned advocate and scholar with a doctorate in law. Dr. Oosthuizen is deeply committed to advancing ethical, equitable healthcare. His work champions patient dignity, practitioner rights, and constitutional integrity, especially in the face of sweeping reforms like the National Health Insurance. Get ready for a conversation that blends legal insight with a passion for justice and compassionate care. Thank you so much, Doc, for joining us. Now, let's maybe speak about this. I just want to find out from you about SAMA's foundational position on the National Health Insurance Act. And also, let's speak about whether you support the universal health coverage as you speak about that.
Yeah, certainly, James, and thanks so much for having me. It's a very important question. I think perhaps SAMA's position has been mischaracterized in the past by the Department of Health, but we are definitely in favor of universal health coverage. We don't support the NHI Act as it currently stands, and that's why we thought it would be very important for us to challenge this law that we believe is flawed and could lead to the collapse of the healthcare system.
And I guess whenever I follow these conversations with SAMA or about SAMA and also their opposition to this particular act, I wanted to find out from you, what are some of those flaws, if you can just share with our viewers?
Yeah, certainly. So the act, going through it's very vague. There are many sections that absolutely make no sense. They're contradictory. It's very difficult to have legal certainty in those circumstances, and it infringes the rule of law. It's also irrational. It's completely unaffordable. We rely on a couple of expert reports that point out all of those significant flaws in the act, especially around the unaffordability thereof, and the massive tax increases that we'll have to see in order to implement some of these reforms. We also note that it would infringe on the rights of practitioners, their right to choose a profession, rights to property, and over and above that, the rights of patients. And I think that is what makes SAMA's challenge unique.
Thank you so much, Doc. Whenever I take a look at what you have to say as SAMA, South African Medical Association, I thought you were all about practitioners' rights. But when I introduced you earlier, and also what you have just said now, you are saying you are talking more about patients' rights. So let's talk about that. I thought you were only for practitioners' rights. So you are also advocating for the rights of patients?
Correct. So SAMA, of course, is an association for medical doctors, but medical doctors are advocates for their patients. And unfortunately, during this debate, patients really haven't had a voice. There aren't a lot of patient-specific groupings in South Africa, and really none of them that have enough funds to challenge an act like this. So being advocates for our patients is, of course, very important, and we thought it would be important to give them a voice in this litigation as well.
And maybe another question, Doc, will be, what gives you that mandate? I'm speaking about representing the patients now in this regard.
As mentioned, our doctors care very deeply for their patients. It's a calling for most doctors. That's why they become doctors. And they want to see the best for their patients. They want to see them healthy. They want to look after their well-being. And therefore, it's vitally important for them to also stand up and say that this is a system that will not only harm us as practitioners, this is a system that will harm our patients.
Yeah, thank you so much. And we are still in conversation with Dr. William Oosthuizen, joining us here from South African Medical Association. Now, earlier on, I may have jumped the gun when I asked you about some of the flaws in this particular act, the National Health Insurance Act. But maybe let's speak about that. I wonder if maybe some of those flaws are actually included in what you are raising in court. Let's speak about that now. The key constitutional issues that you are raising in court as SAMA, what are those?
So we dive very deeply into this act and dismantle it section by section to point out the contradictions, point out where it's vague, point out where it is irrational, and we rely on 3 specific expert reports in doing so. That informs our challenge. So one of our experts, Value in Research, they looked at the affordability of the NHI Act. And they highlighted that we would need something like 200 billion extra to fill the gaps, which would lead to a increase in tax of something like 40%. Value-added tax would need to increase to 22%. And I mean, like we all know, the economy is already in a very difficult position and wouldn't be able to absorb those sort of increases. We also rely on the expert report of Prof. Skokens, who's a world-renowned international expert on social security law, where he also points out the flaws in what has been put forth as how you would go about implementing UHC. NHI is one such mechanism, but it is by no means the preferred or the only option to do so. And it might actually be irresponsible to jump straight to such a complete overhaul of the healthcare system rather than doing it incrementally, using the strengths of the system that we currently have, the private sector, strengthening the public sector, and filling those gaps to increase coverage for the nation.
Yeah. Earlier on, you spoke about UHC, and I think maybe just to help our viewer, because we are more for an ordinary South African. So by UHC, you are referring to universal health coverage. Am I correct?
Correct.
Thank you so much for that, Doc. Now, let's speak about also a couple of other issues that are also raised in this regard. And maybe one will say, before the Act became the Act, it was the bill before. Let's speak about that. As South African Medical Association, Doc, did you maybe have a voice at that particular time? Did you raise your voice leading up to this being signed into law last year by the president?
Yes. I mean, we've been involved in this debate since before the Green Paper came out. So we've been making submissions on this since 2007. On the Green Paper, we made our submissions. On the White Paper, we made our submissions. When the bill came out, we made our submissions. When it passed through the provinces, we made our submissions. So at every step of the way, we've been raising our concerns and trying to engage with the Department of Health. And unfortunately, many of those vital concerns, or most of them actually, just haven't made its way into the Now Act.
Yeah. Thank you so much. And now, when you follow this conversation, you might actually say some only started raising this issue now. But as you got to hear from Dr. William Oosthuizen, the conversation has been going on. Before it became the bill, before it became the Act rather, the conversation was still ongoing there. So they did not just wake up today and say, we are going to challenge the Act that was signed, or this particular law that was signed by the president last year in May. But the conversation is still ongoing in 2025, July 2025. Now, Doc, let's speak about also now, perhaps when we speak about adequate healthcare to an average South African, I'm always thinking about someone watching this podcast now from the Northwest Province, KZN, a rural area somewhere in Eastern Cape, even locally here in Johannesburg, whether those people are also catered for. So let's speak about whether, as South African Medical Association, you believe that this particular Act is providing adequate healthcare to that average South African that I just spoke about.
Unfortunately not. And it's very concerning because we all know the state of the public healthcare system. Daily we open our newspapers or we hear on the radio about what's been going on, and it's just terrible. And so you understand that people are clamoring for some sort of a solution. They're desperate, and we're desperate to improve the healthcare system. But the NHI Act, although it's being held up as a silver bullet, might just be the final nail in the coffin of the healthcare system.
And I wonder what that is going to mean for an ordinary South African that I've just spoken about in communities that have not really been well serviced. What will this mean then? What are some of those risks that you can also maybe share with our viewers? Some of those concerns in terms of service delivery, because service delivery is taking place at a local level within our local clinics. If maybe things are not going actually okay in this regard, what is that going to mean for service delivery?
So, I mean, health systems rely on several pillars. The NHI Act only looks at the financing pillar of the healthcare system. It doesn't speak to the human resources, it doesn't speak to information systems, and it especially doesn't address accountability and governance. And that is why we are so concerned that we'll be throwing money at a problem and we won't see any actual results because the fundamental changes that need to happen to the system haven't been implemented. So it is vitally important that we rather build on what we have, strengthen the system, make it ready for universal health coverage, and rather utilize the great strengths that we have in the private sector and some of the wonderful work that doctors and other healthcare workers do, rather give them additional assistance and try and bolster the system in that way and move gradually towards an NHI.
Yeah. Now, as you are watching this conversation, continuously share this with with other community members who may actually not have heard about the National Health Insurance Act. Make sure that you also check out on our YouTube page, YouTube channel that is TimiaAfrica, and make sure that you share this information with others, because a well-informed nation is a nation that then knows what to do if maybe things are not going accordingly, as Dr. William Oosthuizen was mentioning earlier on. And one of the issues that you raised as South African Medical Association, Doc, was the centralizing complaints under the National Health Insurance Fund. Maybe talk to us about that. Why is this an issue?
So the complaints mechanism in the Act is very bare bones. It's, as you mentioned, very centralized. It's hosted at the fund level. Whereas the current system we have today, although not perfect, it is much more decentralized. And if you do have complaints, you can either take those up at the various facilities where you are, you can go to the Office of Health Standards Compliance, you can lay complaints with the Health Professions Council, for instance, if it is an issue about misconduct or unethical treatment that you've received from a healthcare worker. So the current mechanism provided for in the Act is deeply flawed and not really capable of addressing the magnitude of complaints that a system like this will likely face.
It just actually came to my mind, Doc, whether we'll see perhaps medical practitioners then leaving South Africa to look for greener pastures elsewhere.
Yeah, that's very. It's one of the points that we highlight in our papers as well. We did surveys amongst our members where it was found that more than 60% of them currently in the public sector have some form of moral distress, where they feel because of the resource constraints and other issues in the public healthcare system, they cannot provide the service that they want to provide to their patients. Many of them indicate that if they had to do it all over again, they perhaps wouldn't study medicine. Many others indicate that they would advise their kids not to study medicine. And previously we had done surveys that indicated that practitioners would actually consider leaving the country if the NHI were to be implemented.
Let's speak about this now. It does actually get implemented. What is it going to say? What will it mean when it comes to the working conditions of these medical practitioners? Let's talk about those who are going to be in South Africa, not leaving the country. What is it going to mean for them?
So, I mean, we've already seen the system under immense strain. Earlier this year, we had, was it close to 2,000 doctors that were unemployed? Currently, there are still doctors struggling to find employment. We've got a massive human resource shortage, and we just don't see things improving under the NHI Act. There are human resource plans that haven't received adequate attention, and we've been directing our attention and resources to the implementation of an NHI rather than strengthening the system, ensuring that we have enough doctors, enough nurses to actually provide the care that our patients so desperately need.
Yeah. So I'm sure that you have also been watching on different social media platforms. And when I followed this conversation about NHI, I remember there was a joke that was made on social media to say, once the act is implemented, you can walk into any private practice and you're going to be cared for. And maybe let's speak about that, Doc, whether when this does actually become implemented, what is the future of private practices in South Africa, including also medical schemes? Do you even need a medical scheme if we have the National Insurance Act coming into effect?
So again, it's, as you mentioned there's a lot of propaganda and perhaps disingenuous statements that are being made, and it's misleading the public because that certainly won't be the case. And we all might wish for that to be true, but the reality is it just won't be. As to the second part of your question there, so the plan with NHI is to implement it, and then Section 33 says once fully implemented, and that is something that the minister decides at his discretion, medical schemes will no longer be able to provide the services that are provided by the NHI. So that would basically have them fall away. But even before that, knowing that this is in the future, it is an existential threat to private healthcare in South Africa. And a large part of the population, and not only taxpayers, rely on the public sector. There are also people that prefer to go to the private sector because waiting times are so long, or they receive better service. So they use money that belongs to them, their disposable income. And this counts for the ordinary man on street as well, to pay for those services because they don't receive it in the public sector. And that is the crux of the situation, is don't blame the private sector that is currently functioning, although not as well as it could be functioning, of course, but don't blame the private sector for the failures of the public sector.
Yeah, because you need to work together as government with the private sector. Now, let's speak about this. You, as South African Medical Association, say maybe the act is not implemented as it is something that you are fighting for in court. Say that does actually become a reality. What then? What is an alternative to not having national health insurance?
We've provided over and over again alternatives to the NHI. One such alternative was brought to them through UHAC, the Universal Health Access Coalition. You just have to check me on the acronym there. But they've provided a substantial proposal that could serve as an alternative to NHI. SAMA is one of the founding members of that coalition, and we provide a workable solution that builds on our current system, doesn't completely throw out the baby with the bathwater, and rather looks at how private and public can work together to strengthen the system to ensure that we reach universal health coverage. But we emphasize the importance of accountability and proper governance frameworks, because that is where we have really dropped the ball in the past. I mean, we know of the examples of Tembisa, and unfortunately, I think we all know Tembisa isn't the outlier. It's just that a whistleblower had come forward and Ms. Babita had given her life to expose what was happening there. But that sort of situation is probably happening in many more of our facilities.
Absolutely, because then we speak about hospitals, we speak about local clinics, and this is happening. So let's say, Doc, the act is not implemented as the South African Medical Association. That is something that you are hoping does actually become a reality. Let's then speak about what then you want to happen going forward. What are some of the reforms, if you like, would you like to see being revised in the national health insurance to make sure that it does actually become inclusive?
Yeah, so a lot of that is contained in our UHAC proposal, as mentioned earlier. It's strengthening the system. It's using the regulatory mechanisms that currently exist to ensure that the system provides the services that we expect. And we want to partner with government. Yes, we are taking them to court because we firmly believe that this isn't in the interests of the public, of our patients, of our doctors, of the healthcare system. But the door's open, and we've been wanting to engage for more than a decade now. Come and speak to practitioners. We are the ones that are going to implement these systems. We are the ones that are going to provide care. Let's work together and build a system that actually works. Let's not toss out everything we currently have and implement some sort of a pipe dream.
Yes.
Let's be realistic about this, and let's all work together.
We have to work together. Now, as I'm listening to you there, I'm talking as someone from the outside, someone who happens to be a reporter, someone who happens to be the host of this particular podcast that is about informing our nation. And it actually makes me think that maybe the problem has been there for a very long time. Before even the conversation about the National Health Insurance Bill, the National Health Insurance Act, I get a feeling that you are not actually being listened to as a medical practitioner, Doc.
Yeah, you've hit the nail on the head. That's the sense that we also get, or that's the feeling amongst our members. That's the feeling amongst the industry. That's why you've seen coalitions like the UHAC that includes, I think, 33 different organizations. Yeah. And it's not only the private sector, it's the public sector as well. Our doctors are under immense pressure. They're facing considerable strain. They are seeing impossible things in their facilities. There are medicine stockouts. They don't have equipment. The infrastructure is crumbling. We need to see a change.
It then makes me think about the mental well-being of these medical practitioners, because if they are not well mentally, if they are not well also, they won't be able to better serve their communities that they are supposed to serve.
Yeah, it's a pandemic. I mean, I deal with doctors every day. I hear them speak. There's burnout. Many of them are struggling. They're hanging on. They remain in the system because they are committed to their patients. That's the only reason why they're still there. There are some of them that just couldn't bear it anymore, and they've left to either the private sector or to other countries, and that situation is untenable. We need to create an environment for them where they feel that they can treat their patients with dignity, and we need to keep our doctors in the country, in our system, in the public system.
Why should we be actually concerned about this? What kind of questions also, Doc, should we be asking as ordinary South Africans as you get to the end of the show?
Yeah, it's a loaded question. I think, as mentioned earlier, many of us are struggling. The system is failing us. We've seen significant human rights abuses, people not treated with the dignity that they should be treated with, and we are understandably desperate. We're calling out for reform. We're looking for change. The NHI has been held up as the magic bullet. Unfortunately, it's not going to solve all of those problems. The way in which it is designed, it makes it impossible to solve those problems. It isn't designed to solve those problems. We need to strengthen our public healthcare system, and we need to keep the people accountable. Those who are supposed to speak for us, those who have been appointed to these leadership positions, we need to hold them accountable.
Doc, thank you so much for this conversation. As I mentioned earlier, that we have this kind of conversations with you as people from the media, so that we can also better inform. So I'm grateful that you got to make time and joining us on the show today.
Thanks so much.
Thanks so much. Dr. William Oosthuizen joining us from the South African Medical Association. Now I must say that listening to what he had to say there, you almost also feel like we are not doing enough as ordinary South Africans. Our voices have been silenced. What then are we going to do going forward to make sure that we don't actually reach this particular point where the Medical Association of South African Medical Association themselves feel like they have not been listened to? Have we been listened to? What kind of questions should we be asking going forward? Dr. William Oosthuizen mentioned earlier on that those are some of the questions. Use social media platforms to make sure that you ask necessary questions. Make sure that you follow up whenever you hear of such acts before they get to be implemented.